Good evening, everyone, and thank you for joining me. Today we're going to talk about bipolar affective disorder. Bipolar disorder is a type of mental illness characterized by extreme mood swings that range from hypomanic episodes to depressive episodes. In this presentation, we will discuss the definition and the prevalence of bipolar disorder, the diagnostic criteria, and we'll even discuss a case example and common treatments. I know we all hear bipolar disorder and we refer to people casually as a disorder characterized by ups and downs. But there's actually a lot more to it than that. It's a serious mental illness, and the sufferer's ability to function everyday life is impaired. For someone with bipolar disorder, normal levels of energy are abandoned and replaced with emotional states that occur at distantly separated times. For example, multiple times over the course of a disorder spanning months or years, collectively referred to as episodes of mood. These mood episodes, which cause changes in levels of energy, activity, sleep habits, behaviors, and frequently result in marked impairment in functioning in one or more important areas of their life. For example, school, work, home, relationships with others, and other important activities. What is bipolar disorder? Bipolar affective disorder is a chronic mental illness that causes significant shifts in mood, energy levels, and the ability to think clearly. These mood swings can range from manic highs, where individuals feel overly energetic and elated, to depressive lows, where they feel hopeless and lethargic. So the prevalence and demographics of bipolar disorder, we're going to discuss that. Bipolar disorder affects about 1% of the global population. It occurs equally in men and women, although it can manifest differently across various races and ethnicities. Research shows that African American individuals are often misdiagnosed with schizophrenia instead of bipolar disorder, underscoring the need for accurate diagnosis. There are many different cultural differences in the symptom expressions. So, for example, African Americans are twice as likely to be diagnosed with schizophrenia when in fact they have bipolar disorder, as we discussed earlier. The chances of them receiving an accurate diagnosis are often reduced when they display symptoms in unfamiliar ways. For example, communication styles. African Americans might express their symptoms differently compared to other cultural groups. They may use more vivid, expressive language when describing their mood and behavior, which can be misinterpreted by clinicians unfamiliar with these cultural nuances. And that's just a small piece of it. So, for the diagnostic criteria, we have two different kinds of bipolar. We have bipolar 1 and bipolar 2. Bipolar 1 disorder, in a nutshell, basically is classified by a manic episode that lasts for at least 1 week, or a depressive episode that lasts at least 2 weeks. Bipolar 2 disorder is classified as very similar. It's a hypomanic episode, but it lasts at least 4 days. So it's just a shorter period of time. And the same with the depressive episodes. So we're briefly going to discuss a case example. We have a 30-year-old woman here by the name of Leah, and every month she becomes unusually happy, and energetic for a week before a 2-week period of severe depression where she feels low, devalued, and thinks about death repeatedly. What do you think she would be classified as? Bipolar 1 or 2? If you guessed bipolar 1, you are correct. Leah's symptoms align with diagnostic criteria for bipolar 1 disorder. So treating bipolar disorder usually involves a combination of medication and psychotherapy. A first-line treatment for a mood stabilizer is usually lithium. It effectively reduces both manic and depressive episodes. Oftentimes, physicians may use anticonvulsants such as lamotrigine, also called Lamictal, or antipsychotics like quetiapine or Seroquel or olanzapine. This can help manage acute manic episodes. Now, psychotherapy, physicians may use cognitive behavioral therapy, which helps manage depressive symptoms and prevent relapse, or even psychoeducation, which informs patients about their condition and promotes treatment adherence. Does anyone have any questions at this moment? So we're just going to wrap this up. Bipolar affective disorder is a complex disorder that requires a multimodal approach in making a diagnosis and treating a patient. I have explained the symptoms associated with the illness, the official diagnostic criteria, and have outlined some treatment options. This presentation was intended to help you all better understand the disorder and manage the complexities, which could hopefully lead to improved patient outcomes. Thank you for listening, and I'm happy to answer any additional questions at this time.